Thank you. Moving on, we have here the immune globulins. Next slide po. So immune globulins are immunizing biologics that contain specific antibodies. It is derived from the blood of humans who have survived an attack of a specific disease who have been immunized. It may be obtained from plasma or serum pool of a large number of random donors or from a limited number of individuals who have been hyperimmunized against a specific antigenic material. Next slide po. So we have here the immune globulin, immune serum globulin human, immune globulin intramuscular or gamma globulin. So it is a sterile non-pyrogenic solution of globulins and contains many antibodies normally present in adult humanhood. So immune globulin has some prophylactic value which is the chickenpox, hepatitis A, and rubella. So in many instances, serum globulin offers no benefit after onset of disease symptoms. However, measles can be modified by this preparation. So next slide po. So for the use and dose, it is a passive immunizing agent. Um, Immune globulins, yes, it is a passive immunizing agent, and it also be give it is also given to treat gamma globulin deficiency for the prevention of recurrent infections. The usual intramuscular dose is 0.2 ml per kilogram for measles prophylaxis and 0.02 ml per kilogram for prophylaxis against hepatitis A. And we have here the prescription products. We have the Gamastan, Immunoglobin, and the Gamar. Next slide po. We also have immune globulin intravenous or IgIV. It is for injection into a vein. So it provides immediate antibody levels and treatment for immunodeficiency syndrome, especially in patients who require an immediate increase in immunoglobulin blood vessels. So we have here the prescription products, which is Gamimune and the Sandoglobulin. So next slide po. So we have pertussis immune globulin. So pertussis, it is also known as whooping cough. As said earlier, it is a highly contagious respiratory disease. It is caused by the bacterium Bordetella pertussis. Pertussis is known for uncontrollable, violent coughing which often makes it hard to breathe. So, pertussis immune globulin is a sterile, non-pyrogenic solution of globulins derived from the blood plasma of adult human donors. Next slide po. Next slide. So for the use and dose of pertussis immune globulin, it is used in the prophylaxis and treatment of pertussis. Usual intramuscular prophylactic dose is 1.25 or 2.5 ml. And for the prescription product, we have here the hypertusis. So next slide po. So next, tetanus immune globulin. So tetanus, also called lockjaw, is a serious infection caused by the Clostridium tetani. This bacterium produces a toxin that affects the brain and nervous system, leading to stiffness in the muscle. If Clostridium tetani spores are deposited in a wound, the neurotoxin interferes with nerves that control muscle movements. So, tetanus immunoglobulin is a sterile non-pyrogenic solution of globulins derived from the blood plasma of adult human donors who have been immunized with anus toxoid. Um, the immune globulin is especially useful for passive immunization against tetanus in individuals with wounds that may have been contaminated with tetanus microorganism. So next slide po. Next slide. So for the use and dose, it is employed in the prophylaxis and treatment for tetanus. So usual intramuscular prophylactic dose is 250 units as a single injection. And we have the prescription products, the Homotet, Utet, and the Hypertet. Next slide po. Next slide po. So next, the rabies immune globulin. So rabies is a deadly virus spread to people from the saliva of infected animals. The rabies virus is usually transmitted through a bite. Animals most likely to transmit rabies in the United States includes bats, coyotes, foxes, raccoons, and skunks. So rabies immune globulin is a sterile non-pyrogenic solution of anti-rabies gamma globulin, and it is concentrated by cold alcohol fractionation from plasma of donors hyperimmunized with rabies and vaccines. And it takes approximately 1 week to develop immunity to rabies. So next slide po. Next slide. So for the use and dose, it is used in combination with rabies vaccine as the best post-exposure prophylaxis. So usual dose is a single administration of 0.133 ml per kilogram of body weight. So rabies immune globulin is injected into a muscle or directly into the wound of the animal bite or scratch that exposed you to the rabies virus. So we have here the prescription products, the HyperAb and the Imogam. Next slide po. So we have the hepatitis B immune globulin. So as said earlier, hepatitis B is spread when blood, semen, or other body fluid infected with the hepatitis B virus enters the body of someone who is not infected. So people can become infected with the virus from birth. Example, the spread it is spread from an infected mother to her baby during birth or sex with an infected partner. So hepatitis B immunoglobulin is a sterile non-pyrogenic solution of immunoglobulin. It is prepared from pooled plasma obtained from donors with high titers of antibody to HBs antigen. So the exposure can be either parenteral, direct mucous membrane contact, oral, or oral ingestion. So next slide po. Next slide. So for the use and dose, injections should be given intramuscularly not later than 7 days after exposure, and the recommended dose is 0.06 ml per kilogram of body weight, repeated 28 to 30 days after the first dose. So for the prescription products, we have here the HB, HyperHep, Hep B, Gamma G. Next slide po. We have here the varicella zoster immune globulin. So varicella zoster virus or VZV causes chickenpox and herpes or also known as shingles. Chickenpox follows initial exposure to the virus and it is typically a relatively mild, self-limited childhood illness with a characteristic exanthem but can become disseminated in immunocompromised children. So varicella zoster immunoglobulin is the globulin fraction of human plasma, primarily immunoglobulin G, found in routine screening of normal volunteer blood donors. So when absorbed into the circulation, the antibodies persist for 1 month or longer and are sufficient to mitigate or prevent varicella infection. And it has its greatest effectiveness when administered 96 hours of exposure to the varicella virus. Also, the supplies of the varicella zoster immune globulin is limited. Next slide po. So next slide. So for the use and dose, the dose range is 125 units per 10 kilogram body weight up to a maximum of 625 units. So it is administered by intramuscular injection in the gluteal muscle or in another muscle mass. So for the prescription product, we have aciclovir. Next slide po. We have the RHO or D immune globulin. So it is a sterile non-pyrogenic concentration solution of globulins. So a specific globulin fraction derived from serum of human blood donors immunized to produce antibodies against the D antigen, the most common antigen of the Rh blood group used to prevent Rh sensitization of an Rh negative woman after delivery of a fetus that is Rh positive. So next slide po. So for the use and dose, it is administered within 72 hours of Rh incompatible in the delivery, miscarriage, abortion, and transfusion. And the usual dose is the entire content of vial or 300 microgram of antibody. So for the prescription products, we have Gamulin RH, Hip Pro D, Rogam, and Risonative. So next slide po. So for the next part, we have the biologics related to human blood. So next slide po. So biologics related to human. It is a number of human blood products that have no immunizing property or function are considered biologics. So these products include whole blood, red blood cells, various blood fractions, such blood derivatives as various antihemophilic preparations have specialized applications. So, biologic drugs include a wide variety of products derived from human, animal, or microorganism by using biotechnology. So, types of biologic drugs include blood components, cells, allergens, genes, tissues, and recombinant proteins. So, recent years have been characterized by an increasing sophistication in the availability and use of blood products, and further developments such as the common use of granulocyte and platelet fractions for treatment of granulocytopenia and thrombocytopenia. So next, so we have here the whole blood. Whole blood is a blood that has been drawn from a selected donor under rigid aseptic conditions. It contains heparin or citrate ion as anticoagulant. So, for the use and dose, whole blood is used to treat patients who need all the components of blood, such as those who have sustained significant blood loss due to trauma or surgery. Whole blood can be donated at any Red Cross blood drive or blood center. So RBCs or erythrocytes give blood its distinctive color. So it is also used as blood replenisher and administered intravenously. It is used the whole blood usually in a volume of 1 unit or 500 ml, and it should be stored at a constant temperature between 1 and 6 degrees Celsius. So next slide po. So we have the red blood cells. So red blood cells is whole blood from which plasma has been removed at any time during the dating period of the whole blood from which it is derived by centrifugation or undistributed sedimentation. So it is used to separate the components of blood like red blood cells, platelets, and plasma from each other. So the result is that the particles with different densities precipitate in layers. So that is the use of centrifugation. And it also contains plasma or prophylactic substance. So for the expiration date and storage, it is stored at negative 65 degrees Celsius or colder. It is not later than 3 years after the date of collection of source blood. So for the use and dose, it is used for blood replenisher, useful in cases of anemia, and usual dose is 1 unit of whole blood. So next slide po. So next one is the anti-hemophilic factor. So um, it is freeze-dried concentrate of human anti-hemophilic factor. It also prepared from the factor 8 rich cryoprotein fraction of human venous plasma. By accelerating the abnormality slow clotting time. So factor 8 the is needed for the transformation of prothrombin to thrombin by the intrinsic pathway. So for the storage and expiration date, temperature of 2 and 8 degrees Celsius and not later than 1 or 2 years for the expiration date. For the use and dose, it is intravenous 10 to 20 AHF units per kilogram of body weight, 1 or 2 times a day to maintain a proper blood level of factor 8. And for the prescription products, we have factor 8, Hemophil, Humafac, Coate, and Profilate. So next slide po. We also have anti-hemophilic factor 9 complex. So it is a dried plasma fraction comprising coagulation factors such as plasma thromboplastin, prothrombin, proconvertin, and Stewart power factor. So for the use and dose, this preparation is indicated to prevent a dangerous bleeding episode or to perform surgery whenever one or more of these specific coagulation factors is absent in the blood of the patient. So for prescription products, we have Conine, Proplex, and Profilnine or Profilnine. Next slide po. So we have albumin human. So for the description, it is also called normal serum albumin. So it is sterile, non-pyrogenic preparation of serum albumin obtained by fractionating material. Not less than 96% of its total protein is albumin. So for the use and dose, um, it is a blood volume supporter, um, intravenously, um, volume equivalent to 25 grams of albumin. So for the prescription products, we have Albutane, Buminate, Albuminar, and the Plasbumin. So next slide po. Next. So for the plasma protein fraction. So plasma protein fraction is a sterile solution of selected proteins derived by fractionating materials from healthy human donors and testing for the absence of hepatitis B surface antigen. So for the use and dose, this substance is a human blood fraction that is indicated for restoration of blood volume when the patient is in state of shock caused by burns, crushing injuries, and any other causes. So its usual dose is 250 to 500 ml by intravenous infusion. And the prescription products, we have the plasmanate, proteinate, plasmaplex, and the plasmatane. So next slide po. Next, we have radioiodinated serum albumin. So it is sterile, buffered isotonic solutions to contain not less than 10 milligrams of radioiodinated normal human albumin per ml and adjusted to provide not more than 1 millicurie. So we have iodinated 125I and iodinated 131I albumin injection. So kanang ano day guys kay kanang 125 and 131 kay murag subscript na siya. Kanang na. So it is a diagnostic aids for determining blood volume and cardiac output. So for the expiration date and dose, 5 millicurie intravenously. So for the expiration date, 120 days after completion of iodination if it is 125I is used and 30 days if 131I is used. So in addition, iodinated 131I aggregated injection also used as diagnostic aid for determination of pulmonary clearance. So next slide. So for the last one, we have thrombin. So it is a sterile protein substance prepared from prothrombin of bovine. So its origin is through the interaction with added thromboplastin in the presence of calcium. So for the its activity is expressed in units for the basis of clotting a standard fibrinogen solution. So for the use and dose, we have local hemostatic. So when we say local hemostatic, um, it is agents that provide control of external bleeding by enhancing or accelerating the natural clotting process through various physical reactions between the agent and blood or by mechanical means. So it is applied topically to control blood oozing from the capillaries and small venules when the area is accessible. And it is also useful in dental surgery, laryngeal and nasal surgery, plastic surgery, and skin grafting procedures. And this thrombin is may be applied as a powder or a solution containing 100 to 2000 NIH units per ml in sodium chloride irrigations or sterile water for injection. So for the prescription products, we have Thrombinar or Thrombostat. So that would be all. Thank you.